Okay. Hello, everyone. This is Dr. Garrett Smith, the nutrition detective around these here YouTube parts. And today on episode 185, I'm so excited to get to 208, right? Because that'll be 4 years straight without a missed week. Knock on wood. That'll be exciting. So anyway, I just keep counting them down. Today, we are going over potassium. I had multiple requests to go over this. Potassium is, let me just say this. So first I'm going to go through the research, a bit of research on how potassium is connected to all top 10 killers of Americans today. As I tend to do whenever I do a special episode on a nutrient, a mineral that we use, I go over how it's always connected to the main diseases that are killing us. This is why toxic bile paradigm connects to everything. I mean, you shouldn't be able to find, if it wasn't true, you shouldn't be able to find evidence of it being let's say a potassium deficiency being connected to all top 10 killers of Americans today, but it can. So, and there's some interesting research on potassium that I'm going to set you up for so that you understand when you look in the research and you see that at times, some very, very, very sick people have high blood potassium. You're going to understand why. Because there's a reason for it. Things aren't working. It's not that they're eating too much potassium. It's that their kidneys aren't working and their whole system isn't working because they've been poisoned. So to start out, I do have a full article on this in the Love Your Liver program. Actually, I think my articles in the Love Your Liver program I think there's 6 articles in the potassium section in the Love Your Liver program. So if you want more info, then I may forget some things here. If you want more info than I give here, then that's where you want to go to get it. And if you want to be able to talk to a giant community of people who are doing this, then that's the Love Your Liver program. Joe put the link on the screen, members.nutritiondetective.com, and that's where you can get in now. So, okay, let's head into it. Let me find my first link. I put the link to the Google Doc with all these links that we're going to go over in the comments of the live chat. Sorry, in the live chat. Let me go here. Let me go share. I forgot to share, Joe. We forgot to have me share before we started. Not this one yet. Okay. So here we are. This is just an article, top 10 leading causes of death in the United States. Here they are. Decrease in death rates is not one of them, but this is the order I'm going to go through them. And this one, yeah, we're not going to say that word too many times. We're going to talk about it, but it's really the flu, which is a toxic bile dump, an extended toxic bile dump that's leaking into your system, causing symptoms. And if you don't know that yet, you should go watch the live stream number 71 or number 53 on this channel so you can get a background of toxic bile paradigm. We used to call it toxic bile theory. And so you understand why all of a sudden everything in your body goes haywire when you get sick. It's not because of some virus floating around there just waiting since they don't move to invade your system and reproduce. Just imagine if virus theory was actually real, they would be unstoppable and everybody would be dead. They may find things like cytopathic, as in cell waste, like cells breaking down. They find things, but that doesn't mean that that's what's causing your problem. So anyway, if you want to do this work here, if you're an ardent virus believer, you're probably in the wrong place, or at least you haven't figured it out yet. So let's get into it. Okay. First off, 1962 study, long before the vitamin D supplement, the rat poison vitamin D supplement of today, there was this study. Renal, which means kidney, potassium wasting induced by vitamin D, and they mean vitamin D supplements. Okay, they're not talking about getting sunlight. I mean, although, imagine like you go out in the sun if you sweat too much and you're out in the heat too much and you're doing all this stuff too much, yeah, you're going to sweat, you're going to lose electrolytes, you're going to lose sodium, you're going to lose potassium, you're going to lose magnesium. Yeah, you're going to lose that stuff. But we're talking about here supplements of vitamin D. Now, one of the first things that got me into the rat poison that is vitamin D and how it is not good for you, the supplements, is when I first got into hair analysis. I was taught that somebody taking vitamin D can easily be seen on a hair analysis because they have very high calcium and they have very low potassium on a hair test. So it's like this. They call that, when you look at the ratio between those two, they call that the thyroid ratio. As in, high calcium to low potassium is hypothyroid. That's like a state that you would associate with hypothyroid. Low potassium is not good for your thyroid, first of all. But the thing I want you to think of is if you've been taking vitamin D and let's say you're getting some potassium deficiency symptoms, some of the easiest and earliest ones you can see: anxiety, depression, fatigue, muscle twitching, muscle cramping, getting very tired very soon after eating. That's a big potassium symptom. Now, you don't have to have any of those to have potassium deficiency symptoms, but those are some of the earliest ones that you can notice. So if you've been taking vitamin D and let's say you're getting stiff and cracking and popping, and you're also getting anxiety or depression or getting more tired or having trouble falling asleep initially at night, that's another one. So when you first go to bed, you have trouble falling asleep. That can also happen from copper toxicity. Copper tends to deplete potassium out of your system too. So first, you got to remember, we got the vitamin D fad, and then you're going to see tons of stuff with low potassium with what we're going into, okay? These are not coincidental. This is one cause of it. Most people are not eating enough potassium, first of all. And then they add these killer supplements to it, and then it gets worse. So we got that first. Now, let's go into this. Vitamin A. What does vitamin A do in your system? This is going to be, you're going to want to pay attention to this part for the cancer part that we go into, okay? Retinoic acid, which is what they call the active form of vitamin A. So they're saying the active form of vitamin A, the stuff that actually is what vitamin A supposedly you need it to do, it blocks potassium channels. Things that you generally need probably don't block things very much, right? Doesn't that make sense? Toxins would block things. And what this means, what vitamin A is doing in your system by blocking potassium channels, you're supposed to have more potassium inside the cell than outside, okay? So when they're talking about potassium channels, they're really talking about the potassium cannot move back into the cell. That's bad. That's really bad. You don't want to block potassium channels so that the potassium can't get back into the cell. So now what we can see in people, what does this mean? Well, if you can't get enough potassium into the cells, you can have symptoms of potassium deficiency while there's still plenty of potassium around. Does that make sense? Like if you're on your property, but you're not in your house, then you're not getting the benefits of being in your house. Does that make sense? Like you want the potassium to be inside the cell, not outside. I mean, it's a balance. It's always a balance, of course. But if it can't move back in, you're kind of stuck. If it was freezing out and you can't get back in your house, but you're on your property, is that helping you? No. So this is how, folks, you can have normal potassium levels on a blood test. And remember, their ranges suck. You could have normal potassium on a blood test, but still have potassium deficiency symptoms. Does this make sense now? Especially if you're vitamin A toxic. So what are two of the first things we do to reduce the toxins coming in that are causing potassium problems? Well, actually three. We avoid vitamin D supplements entirely. We reduce, minimize, or eliminate vitamin A sources in our diet. And then we work on copper toxicity, and we work on that multiple ways. You can't avoid copper in your diet if you're going to eat plant foods, but you can definitely reduce them, and we can antagonize the heck out of it. So these are the two big things that we work on that nobody talks about in terms of potassium problems. And we've shown that there's a vitamin A toxicity epidemic. So when you see potassium connected to all 10 of the diseases of today. You'll understand why. Okay. So now we're going to head into the diseases. The first one was heart disease. We did a whole, oh man, Joe, GLASP has been weird. It's not doing my highlights. This is happening all over. Anyway, I did cardiovascular disease last week. So I'm going to hit on these real quick. Oh man, low potassium. I hit on this last week, so I'm not going to do a lot on this because I got to be done in a certain amount of time, and I know you guys want the meaty potassium info. Low potassium to sodium intake ratios are more strongly related to cardiovascular disease risk than either nutrient alone. You may be eating a ton of sodium and think you're eating a ton of potassium, but you may not be eating enough potassium to counter the sodium that you're eating. Do you understand? So this is actually a ratio thing. Most people don't even eat as much potassium as they do sodium. That would be a low potassium to sodium ratio. If you're not even equal in amounts of sodium and potassium, you're in trouble already in your diet. I want people to be getting at least twice as much potassium as sodium in their diet. So whatever amount of salt you're eating, I want you getting twice as much as that in potassium. Okay? Very simple. You don't want a low potassium to sodium ratio. You want potassium higher at minimum. At the very minimum, you want more potassium than sodium. Better would be twice as much. Okay. Oh, GLASP. So, well, let's just, I can't even get the GLASP thing to disappear now. Effective increased potassium intake on cardiovascular risk factors and disease. What happened? Well, let's go find that. Well, I'm just going to read the quote here because it's not showing. This is a quote from this paper. High quality evidence shows that increased potassium intake reduces blood pressure in people with hypertension. That's good. And has no adverse effect on blood lipid concentrations, catecholamine concentrations. That's like your epinephrine, norepinephrine, adrenaline, noradrenaline, and serotonin, stuff like that, and dopamine. Or kidney function, renal function in adults. Renal means kidney. Increased potassium. So they'll tell you, you got these kidney doctors out there telling you that if that potassium causes kidney problems, or if you have kidney problems, you should avoid potassium or minimize your potassium. Has no adverse effects on kidney function. That'd be weird, right? So modern medicine looks and they go, oh, we have a disease. This is high here, so this must be bad for it. That's not true. Right? If you popped your bike tire and there's the air left the tire and it's outside the tire, then medicine would come and look and go, there's too much air outside the tire. This is bad. And so then the whatever they do with that stupid analogy, but do you understand? It's when things are in the wrong place, you have problems. So just because the potassium's in the wrong place doesn't mean it's a potassium excess. And we'll go over that in the kidney stuff. Higher potassium intake was associated with a 24% lower risk of stroke. We'll get to strokes. Okay, so let's keep going. Again, like I did these last week in my the last 2 weeks in my 2-part heart disease live streams. Okay, sodium and potassium intake in cardiovascular disease in older people, a systematic review. Here's the quote. We found that both the increase of potassium intake and the decrease of sodium to potassium ratio, so more potassium, less sodium, that's how you decrease that, was associated with lower risk of hypertension, blood pressure, high blood pressure, right, and cardiovascular disease, particularly stroke. Conclusion, the present review suggests that both higher potassium and lower sodium to potassium ratio are associated with a lower risk of cardiovascular disease. So if anything you learn from today, I'm not anti-sodium. I'm pro-potassium. And could you be doing too much salt? Sure. We can all do too much of things. Like there's a megadosing salt thing on Twitter right now. There's a megadosing everything right now on Twitter. It's just absolutely, I won't use the R word here, but it's absolutely insane. I just saw a guy promoting 3 milligrams, 3,000 micrograms of molybdenum a day. That is 20 times my basic dose. And if you don't understand the research on molybdenum, yes, you can take too much molybdenum. And yes, way too much molybdenum could cause you gallbladder problems, bile duct problems, and liver problems. You can overdo anything. Do you think taking 20 times what I suggest as the basic dose, if somebody's not testing, I suggest 150 micrograms a day for most people without testing as an okay, safe, long-term dose. Some people can't handle that, and so they don't take it. If they don't feel good on it, they don't take it. But what do you think is going to happen to people who are taking 20 times the dose that I suggest? Like if I say zinc, like the long-term safe dose that I found that's good for people who are not testing, 30 milligrams. So if somebody's taking 600 milligrams of zinc a day, could they get into problems? Yes. If somebody said to, I'm not pushing this, but if somebody said, drink a half a gallon of water a day, and then somebody goes and drinks 20 times that, so they drink 10 gallons of water a day, they could kill themselves. They probably would. So don't be stupid out there. I'm telling, this is for everybody in the Love Your Liver program. This is for anyone listening. Mega dosing stuff is a drug effect, and it's going to mess you up. You can take something good like zinc or molybdenum and take way too much of it, and you could feel better. However, these things can accumulate in you too if you put too much in. If you see anybody in the Love Your Liver program or out on the internet who is talking about my stuff, if you are mega dosing stuff, you're not doing my stuff. Don't claim you're doing my stuff. When you get messed up, don't say I messed you up. I didn't. If you are mega dosing stuff, you're not doing nutrition. You're doing drug-like effect, okay? This is a very serious problem. Don't blame me. I've always been telling people, like, don't go over these doses. And then some people who think they're smarter than they are decide to go and do it. And it bites them in the ass later. Role of dietary salt and potassium intake in cardiovascular health and disease, a review of the evidence. Well, see, now the highlight's working. I don't understand GLASP right now. But anyway. So again, I'm not anti-salt. We do need salt. You need clean salt. I have a whole section of articles on salt in the Love Your Liver program. Don't buy unrefined salt unless you want to buy toxic metals and microplastics and all that stuff. So evidence from these studies demonstrates that high salt intake relative to potassium not only increases blood pressure, but also plays a role in endothelial dysfunction, cardiovascular structure and function, albuminuria, and kidney disease progression. And cardiovascular morbidity and mortality, that's what am I trying to say? Disability and death in the general population. Conversely, dietary potassium intake, which you need to have more than your sodium, that's the more important thing, attenuates or lowers these effects, showing a linkage to reduction in stroke rates and cardiovascular disease risk. Various subpopulations, such as overweight and obese individuals, full of toxicity, and aging adults, they've lived longer, they're more full of toxicity, exhibit greater sensitivity to the effects of reduced salt intake and may gain the most benefits, probably because their potassium intake sucks. So reducing their salt intake makes their ratio better. A diet that includes modest salt restriction while increasing potassium intake serves as a strategy to prevent or control hypertension and decrease cardiovascular morbidity and mortality. Okay, so I just hit on those real quick. Let's go to cancer. Okay, not going to spend a lot of time on this. First of all, for anybody out there who likes to quote modern cancer research, or they'll say that, ooh, ivermectin has 14 or 15 different anti-cancer mechanisms. Yay. Okay. Understand this. How good is modern medicine at fixing cancer? They suck. They suck at it. So why do you care about their mechanisms? They're no good at it because they look at it as your body's broken. So we're going to fix it. Again, they're going to say, if it's too hot, we make it cold. If it's too cold, we make it hot. If it's too dry, we make it wet. If it's too wet, we make it dry. That's what they do. That's how they base their drugs on it. So if you see cancer and they say, you have too much of this. So what does that mean? What actually is the root cause of it? Right? So let me get back to that window. Now, pay very close attention. Potassium channels in cancer. Where do you think I'm going with this? Retinoic acid. Oh, do I need to share? Wait, hold on, Joe. Let me pull that up again. Is this working, Joe? Joe, let me know if it's working. Yeah, it is. Okay, great. Okay. Potassium channels in cancer. What do you think we're going to find about if let's say, oh, I don't know, vitamin A, a fat storable toxin, was implicated in cancer because our body makes cancer tissues to store toxins. If we were storing a lot of vitamin A and vitamin A blocks potassium channels, what do you think we might find in cancer? Okay. Neoplastic transformation, that's the formation of cancer, or they're saying normal tissue turning into cancer, is reportedly associated with alterations, changes of the potassium transport channels across plasma and intracellular membranes. These alterations have been identified as crucial elements of the tumorigenic reprogramming of cells. So potassium not moving across the cell membrane is critical to the development of cancer. Gosh, what might be too high inside of these cancers? Vitamin A, maybe? Potassium channels may contribute to, they don't contribute to cancer initiation. Blocking them does. Potassium channels may contribute to cancer initiation, malignant progression, and therapy resistance of tumor cells. Potassium's not getting into the cells, right? The book chapter focuses on oncogenic, cancer-causing potassium channels. So they're going to say that your own potassium, this is the PSYOP. This is how they have to make it. Cancer is your fault. That's what they have to tell you. Cancer is your fault, is what they say. It focuses on cancer-causing, cancer-creating potassium channels, frequently upregulated in different tumor entities. I want you to understand, if you block something in the body, what does the body try to do to counter the dumb thing you're doing? It upregulates other things, right? Like if you take hormones, your body will downregulate the receptors for the hormones, right? So if you block something, your body will desperately try to make more of it. So these guys look in cancers, in tumors, and they say, gosh, there's a lot of potassium receptors and channels. And why is the body making these? These must be bad. No, it's because the tissue is starving for potassium. Now, what else stores in cancer? Copper. What did I tell you depletes copper? Depletes potassium. Oh, it's copper. Vitamin A blocks potassium channels. Vitamin D depletes potassium. What a weird pattern of things, right? Vitamin D is a fat storable alcohol. Vitamin A, retinol, is a fat storable alcohol. It turns into an aldehyde. Copper raises aldehydes in the system. These are all the things that we are connecting. Okay. Upstream and downstream signaling of these channels, their contribution to the maintenance of cancer stemness and the formation of an immunosuppressive tumor microenvironment. Your immune system is a cleanup crew. That's what they are. Just imagine modern medicine knows nothing about cancer. And if you follow any of their stuff, even their mechanisms, you're going the wrong way. But does this mean potassium is going to fix cancer? No. Okay, I want you to understand the potassium thing in this program. If you're toxic, you've been taking vitamin D supplements, you still got them stuck in your tissues, they stay at least a year. Vitamin D supplements, when you go off of them, it takes, from my estimation, it takes at least a year to get rid of the vitamin D out of your system after you stop supplementing it, okay? Vitamin A is 2, 3, 4 years. Getting copper down, 2, 3, 4 years. Oh, really, really down. Really down. I just worked with a guy yesterday. Folks, his serum copper is 35. The copper lovers out there would freak out. Do you want to know how well I've been doing for this guy? This gentleman has been with me for 18 years. That's how much he believes I help him. He says all the other doctors are full of crap. So, yeah. And he went with me through all the phases. And now we're here. And like I said, serum copper, 35. That's super low. Why isn't he just falling apart with copper deficiency symptoms? Someone explain it to me. This is regular. Like, his serum copper has been this low for a while now. Someone please explain to all the other people about how this guy doesn't have copper deficiency symptoms. His serum zinc is at least twice what his serum copper is. Does he have zinc toxicity? Does he have copper deficiency? No. That's on blood tests. His hair test, his copper is great, and his zinc is great on a hair test. This is why we do both. He has great copper, like low where I want it, and good zinc on the hair test, and his blood test is low in zinc for where I want it, but his copper is twice as low. Why do we do both blood and hair? Well, first of all, if you're out there listening to anybody talking about copper and zinc and they're not measuring, they're full of crap. Just disregard them. Second, why do we test zinc and copper two ways? Because it's that important, and because different tests can show different things. So that's your cancer thing there. Okay, let's go into, the COOF. The COOF. I'm not going to spend a lot of time on this. It's not a virus. It's a toxic bile dump. It could have been triggered by, I don't know, EMF. You guys got to understand that. Let's just say there's a coordinated group of people who didn't like us, and they wanted to create an epidemic. And let's just say, if you haven't seen my EMF episode, you should go watch it. Let's just say that they knew there were certain frequencies that could stir up stuff in us so that we all get sick around the same time. Definitely go watch that EMF episode. And so if they could do this, and let's say even they just triggered a bile dump, which I've shown that EMF can trigger bile dumps. Let's say they knew they could trigger this and they do it all at once during flu season. And then they call the flu this. And now the flu's back. It's back in the same numbers, than it used to be. Anyway. So what's the paper? Serum potassium concentrations in COOF. Recent evidence has associated COOF to hypokalemia, low blood potassium, and other ion imbalances with potential implications for patient management, and causal mechanisms to hypokalemia have been proposed, as in mechanisms causing the low potassium. Quite interestingly, Moreno and Perez have described hypokalemia as a marker of disease severity and of need for mechanical ventilation. That's a whole nother story. I'm not going into that. In COOF patients. Hypokalemia as a marker of disease severity. So let's just say you had, let's say you were supplementing vitamin D and it gets stored in your tissues and your liver, and you were eating lots of vitamin A for health and it was storing in your liver and your fat tissues, and you were eating lots of brightly colored plant foods full of copper that is storing in your tissues. And all of a sudden, these are all in your liver, which means your liver tries to get rid of them through bile, and they trigger a bile dump. I don't know if you know this, guys, but during the COOF, I actually went and looked at the pockets of where it started in this country, and it was the same areas where 5G was first introduced. So the whole 5G thing, that was downplayed. They tried to, they put it out in the mainstream media as like, some people actually think it's 5G. No, it actually, if you look at where COOF started, it started in those areas, like in the neighborhoods where they started this. This was triggered. No doubt in my mind. That's why everybody's like, it was the worst cold or flu I ever had. There's a reason why. It was accelerated and made stronger. Okay, so that's all I'm going to stick on that. Oh, the important thing, I think I was about to say this before. If you're, okay, so potassium from food is the best, okay? Potassium from foods is always the best. Potassium from supplements, we'll get into this, can be touch and go. Some people are super sensitive to supplements, and you got to try different potassiums, okay? What we're doing here on the program is in the beginning when you're more toxic. In the beginning when you are more toxic, you may need more potassium. Because you need potassium, but still you're more toxic. So as you're detoxing, these toxins come out and they need potassium to counter them, okay? As you get less toxic, you start getting the copper out of you, you start getting the vitamin A out of you, you stop taking vitamin D and that's all out of you, then you will need less potassium. Do you understand how we do that? The things that are driving your really bad potassium deficiency, that's not going to go away for a while. So in the meantime, you take potassium, whether it's foods or supplements or both, or even we'll talk about the bath. You can put potassium in a bath, but you got to do less than magnesium. Okay. We'll talk about that. We start potassium at the start. You may need more. And as you go, what does this mean? If we need more potassium in the start and we do our detoxing and our nutrient repletion, and over time you need less, what does that mean we're fixing? We're fixing the root cause of your potassium deficiency, both by getting more and by getting rid of the toxins. What do we do here? That's what we do here. So now let's go to the next one. Okay. Oh, the next thing. So sorry, COVID was, no more super chats, y'all. Don't do any more super chats. I gotta catch a plane. So if you do too many super chats, I'm just going to have to leave them for next week. Okay. So one of the next ones, the next cause of death. So I'm going in the order of the top 10 causes of death in the US, right? So we're here at unintentional injury. Okay. You don't find studies on like potassium and unintentional injury. So unintentional injury is like the fourth leading cause of death. So what was the best I could look up? Trauma. I could look up trauma. I'm saying that that's a good enough association to look for what we're looking for. Okay. The clinical relevance of plasma potassium abnormalities on admission in trauma patients. So somebody had some sort of injury. A retrospective observational study. Trauma patients presenting with low blood potassium on admission may be associated with severe head trauma requiring life-saving craniotomy. Basically, that means the lower your potassium when you go in, the worse you're going to end up. Now, here's an interesting thing, and this goes for hair tests too. When the body is under stress, it will put more potassium into the system. I see it on hair tests. Like I call it the stress of detox. When people are detoxing a lot of stuff, I will see their potassium go up on a hair test. The worst thing that you can do if that happens would be to reduce your potassium intake. You're actually losing potassium because of the detox. The detox, when those toxic metals are coming out, your potassium goes up as a protective measure. And possibly those toxins are depleting it out of you, like we saw, renal depletion of potassium by vitamin D. So toxins can push out potassium. So when you see it on the hair test, if you see your potassium go real high, that's usually a loss pattern. You're losing it. So the worst thing you could do would be to see it and go, oh my gosh, my potassium went too high. I better do less. I always tell people on the hair test, you could pretty much ignore sodium potassium entirely and it wouldn't change anything we do. So let's keep going. Trauma patients with hypokalemia have an increased risk of morbidity and mortality, of disease, of like fallout disease, like stuff that you carry with you afterwards. That's morbidity and mortality, is death, risk of death. Okay. Now, so sorry, I was saying this about potassium and the detox stress. The problem would be, so let's say those people, so they're detoxing and all of a sudden their potassium goes up. The good news about that situation is that they have enough potassium stored in them to lose it, or they're taking in enough. So they're taking in enough potassium, or they have enough potassium around in their system that they have it to lose. So their level could actually go up, right? If you don't have potassium enough, it can't go up. So when you see potassium go up in some of these papers, at least it's there to go up. But if you don't have the potassium to go up under stress, you're going to be in real trouble. Do you see how this goes? So if you don't have the potassium to lose, to counter the stress, it's not going to end as well. I think this was all I had on here. Let me see. Yeah, that was it. Okay, no, sorry, Joe. We're still on the same screen. Okay, here we go. This one. Serum potassium concentrations in trauma patients. Hypokalemia, low blood potassium, occurs in 50 to 68% of trauma patients. Does that sound like a lot of people? If we had an epidemic of vitamin A toxicity and vitamin D, rat poison supplementation, and copper toxicity, think people would be running around low in potassium? Among the patients who had hypokalemia, low blood potassium, the serum potassium usually decreased within 1 hour of trauma and returned to normal within 24 hours without significant potassium replacement. So it got back to normal after the stress went away, the immediate stress, the acute stress. They didn't have enough potassium to respond during the trauma. And that's why, as we saw in that last paper, there was more of a risk of death. So yes, potassium deficiency is connected to unintentional injury deaths. Okay. Let's go here. So now we're into strokes. Dietary potassium and stroke-associated mortality, a 12-year prospective population study. As you saw earlier, and as we kind of went over in the cardiovascular disease, I mean, strokes are considered cardiovascular disease. They're part of the cardiovascular system. So we kind of went over this in the heart disease show. Clinical, experimental, and epidemiologic evidence suggests that a high dietary intake of potassium is associated with lower blood pressure. Wow, that's clinical evidence, experimental evidence, and epidemiologic evidence. That you don't get much more than that. With lower blood pressure. One of the first things you should do if you have high blood pressure is try to get more potassium. See if that helps. In hypertensive rats, high blood pressure rats, a high intake of potassium is reported to protect against stroke, even though blood pressure is not affected. So no, potassium will not necessarily fix your blood pressure, but it will make you less susceptible to the damage from it. We examine the relation between 24-hour dietary potassium intake at baseline and subsequent stroke-associated mortality in a population-based cohort of 859 men and women in Southern California. After 12 years, 24 stroke-associated deaths had occurred. The relative risks of stroke-associated mortality in the lowest tertile, that's the lowest third of people in their potassium intake. So the people who got the lowest third of potassium in their diet, supplements, whatever. As compared with that in the top two tertiles combined, the top 2/3, 2.6 in men and 4.8 in women. So that means women had 4.8 times more risk of stroke if they were in the lowest third of potassium intake, and men had 2.6 times more risk of stroke if they were in the lowest third of potassium intake. Do you think you should get some more potassium? In multivariate analysis, a 10 millimole increase in daily potassium intake was associated with a 40% reduction in the risk of stroke-associated mortality. Joe, can you look up how much potassium is in a millimole of, like when we're talking about supplements? I forget what it is, and I didn't get that ready before this, so sorry about that. This effect of potassium was independent of other dietary variables, including the intake of calories, fat, protein, fiber, calcium, magnesium, and alcohol. Wow. It wasn't connected to any of those at all. Just by itself, potassium increased or decreased the risk. The effect was also apparently independent of known cardiovascular risk factors, including age, sex, blood pressure, blood cholesterol level, obesity, fasting, blood glucose level, and cigarette smoking. These findings support the hypothesis that a high intake of potassium from food sources may protect against stroke-associated death. Seems pretty important by itself. Dietary potassium intake and the risk of stroke. A dose-response meta-analysis of prospective studies. Okay, 39 grams per millimole. Okay, so it's 0.039 grams. So we're saying, wait, let me go back to that. It was a 10 millimole increase, and you're saying that is about 1 millimole of potassium is about 40 milligrams. So that would be 400 milligrams, a 390 to 400 milligram increase in daily potassium intake was associated with a 40% reduction in the risk of stroke associated risk of death. Okay. 400 milligrams. That is a banana. That is 8 ounces of coconut water. Think you can do that in a day? Add that to it. Why do you think it's so funny, the haters out there who are like, you eat bananas? And I'm like, yeah, every banana I eat, 40% reduction in the risk of stroke death. Yeah. Keep telling me bananas are bad for me, bro. Go ahead. Okay. So now we're back on this. So this we went over this. We observed a statistically significant inverse association between potassium intake and risk of stroke. More potassium, less risk of stroke. For every 1,000 milligram per day increase in potassium intake, the risk of stroke decreased by 11%. Dietary potassium intake is inversely associated with risk of stroke, in particular, ischemic stroke. So, yeah. The RDA, just so you know, or the RDI, I believe they call it now, the RDI of potassium is 4,700 milligrams. The RDI of potassium by the Institute of Medicine is 4,700 milligrams. To let you know how bad your potassium intake probably is. Right? Everybody talks about, we were talking about bananas and coconut water. A banana or 8 ounces of coconut water has generally about 400 to 500, if you get organic, about 400 to 500 milligrams of potassium per. 4,700 milligrams divided by, let's say, 500 is what? 9.5. 9.5 bananas if you wanted to get all your potassium from bananas to get the RDI. And that just so happens to, like, I'm not saying the FDA is some expert, but the FDA says about, 2,000 to 2,500 milligrams of sodium a day. It's really weird that the FDA says 2,000 to 2,500 milligrams of sodium a day and don't go too much above that. And then the RDI of potassium is 4,700. It just happens to be about 2 to 1. Go try to look at your sodium and your potassium in your diet, and I bet you don't even get as much potassium. If you're not honestly trying, if you're not making an effort, you're probably not even getting half as much potassium as you are sodium. Fix it. It is the two things in the program that people mess up the most, or that I could put it a positive way, they don't take seriously enough, or that they need to take more seriously. First is topical magnesium. I have a whole live stream on it. Topical magnesium, where people get lazy, and potassium. I always tell people in the first time I talk to them, potassium is the thing that can change how you feel the quickest when you get it right. It could change how you feel in 10 minutes. Oh, let me do a quick story. When I had what was called the COOF, one of my big symptoms towards the end was really bad nausea. So I wasn't eating. I lost 10 pounds in 10 days. I had never had anything like that before. So I know that something happened. Am I going to say it's a scaly virus? No, something happened. Many of us know something not right happened. They want to blame it on like some meat market. No, it's not that. The scary government's engineering. No, they did something else. These are all scary stories to tell you, so you have this fear complex. Okay, they did it to us. It was probably EMF. So towards the end of me getting, recovering, I finally felt like eating. And I used, just so you know, I'm not a huge fan of like people taking ginger all the time for their digestion, but towards the end, I was so nauseous, I got some ginger beer, which is non-alcoholic, but it's strong in ginger. So I got some of that. It made me feel good enough that I wanted to eat. I ate a banana, and within 10 minutes, my brain like turned back on. It was insane. So those of you who understand potassium and who have experienced this, if you aren't getting enough potassium and you get it, all of a sudden things turn on like 10 to 15 minutes. Tell me I'm wrong. Tell me I'm right. And then I went and I had another banana because I felt so much better. Oh yeah, we'll go over that. JD said, just don't take too much potassium at once like I did. It will give you heart palpitations. Too much supplemental potassium. I'm going to say it now. If you're messing around with potassium supplements, only go up by about 100 milligrams a day total. 100 milligrams a day total of the day. So if you do 500 one day and you're okay with that, and then you do 600 the next day, and you may split it up, but you only go up by 100 total a day. Do not dive in with potassium. Yes, you can overdo it, especially with supplements. If you want to mess around with taking your level up, like nobody ever says, oh my gosh, I ate 3 bananas instead of 2 and I got palpitations. That doesn't happen. So if you want to go up, experimenting with food sources first, I would much rather, if somebody wanted to go up fast in potassium, that they do it with like more bananas. They're cheap. They're super cheap and easy to do. No, I'm not scared of the sugar in a banana. If you're scared of the sugar in a banana, you're probably super toxic and your blood sugar control probably sucks. It's just the way it is. We fix it. So if you want to fix it, stick around. Low potassium is a big cause of blood sugar problems, as we'll get into. So, people who want to go up fast, coconut water. I mean, a quart, coconut water's in the aluminum packs I don't like, but if you need to get some potassium, it is an option. Like a 32-ounce thing of coconut water, that has anywhere from 1,600 to 2,000 milligrams of it in it. Are you scared of drinking that a day? I'm not. So you could try going up with coconut water or bananas to see your potassium response. And then do that. Okay, so Joe says I have 10 minutes to end the show. I've got about 20, Joe, but I understand what you're doing. You're trying to help me out. Okay. I'm going to move on. I'm going to run through these last ones fast. Oregon Gem, potassium supplements causing nausea is probably a potassium chloride problem. We'll go over that. Okay, so again, sodium, potassium excretion and risk of cardiovascular events. Let's just go down here. Higher potassium excretion was associated with a reduced risk of stroke. Okay, so let's just move on. You're going to see the same patterns. This is lung disease. Okay, so I'm going to hit on the high points. Why is this not letting me in? I was just in here before. I'm not wasting much time on this. Nope, forget it. That one's done. Oh, no, I killed my share. Whoops. Okay, let me share again, Joe. Let's go here. Let me find the window I want. Okay. There we are. So, you need potassium to make your muscles function. It's important. Low potassium. Why does this cause lung problems? So respiratory disease, lower respiratory disease is another problem of the top 10 diseases. Decreased serum level of potassium, the effect on cell homeostasis may have a dramatic effect in cardiac and respiratory muscles, leading to cardiac arrhythmia and respiratory failure by muscle weakness. They can't breathe well because of muscle weakness, because you need potassium to make you do things. That's also why potassium deficiency goes along with fatigue. Okay. Now, let me see what I got here. Risk of respiratory failure among hospitalized patients with various admission serum potassium levels. What did we find? Increased risk of in-hospital respiratory failure requiring mechanical ventilation was noted when serum potassium was below 3.5 or above 5.4 at the time of hospital admission. Do you really think these people had too much potassium in their diet, or do you think stuff is breaking down? Where is potassium higher, in the cell or outside the cell? In the cell. If you start busting a bunch of cells open, you spilled potassium out. Does that make sense? So we can see both. Like, it's really bad when you start seeing high potassium in people who have crappy potassium diets. It's bad. It's really bad. It doesn't mean they're taking in too much. It means they're falling apart. Okay, let's keep going. Okay. This is a funny thing that they studied. This is going to relate to a hair test. Rubidium and potassium levels are altered in Alzheimer's disease. So Alzheimer's disease, dementia. This is the next cause of death in the US. It's altered in their brain and blood, but not in cerebrospinal fluid. Okay. Loss of intracellular compartmentalization of potassium. Wait, so where is potassium supposed to be compartmentalized? Inside the cell. So if you can't, vitamin A, I did a whole thread on my forum about how vitamin A is one of the main causes of Alzheimer's and dementia. So if somebody had too much vitamin A in their system, what does that do? It blocks potassium channels. You can't get the potassium from one compartment outside the cell into the next compartment inside the cell. A biochemical feature of Alzheimer's disease, indicating a loss of membrane integrity. Gosh, do you think retinoic acid, which is used as a chemical peel, could eat away membrane integrity? And I've been over how bile eats away at membrane integrity. And mitochondrial dysfunction, the biohacker's favorite term. We examine potassium and rubidium, a biological proxy for potassium. So one thing, those of you who get hair tests, some people I talk about this, some people I don't. Rubidium and potassium on the hair test, especially when you look at Trace Elements, the company I use, rubidium and potassium move up and down in lockstep. So I thought it was really cool to see this in this paper where they're saying rubidium is a biological proxy, a stand-in for potassium levels. On the hair test, it does this. It's not I call them like a big brother, little brother relationship. The little brother follows the big brother around. In brain tissue, blood fractions, and cerebrospinal fluid from Alzheimer's disease and healthy control subjects to investigate the diagnostic potential. So they're wanting to see if they can tell if you have Alzheimer's or not from potassium and rubidium. Of these two metal ions, we found that potassium and rubidium levels were significantly decreased across all intracellular compartments in the Alzheimer's disease brain. Wait, intracellular's inside the cell? What does vitamin A block? Oh, it blocks potassium channels so you can't get it back inside the cell? Interesting. Okay. Low serum potassium in midlife associated with decreased cerebrospinal fluid A-beta 42 in late life. Folks, your diseases that you get are developing over decades. Sometimes it may just be a short, they may come on very quickly, of course, but most of these diseases have been happening for decades. The toxicity is accumulating over decades. So, what did we have here? Okay, I'm just going to make this quick. Cerebrospinal fluid amyloid beta 42, A beta 42, which is so it's decreased in Alzheimer's disease patients. Okay. Findings suggest low serum potassium in midlife, but not late life, is associated with low cerebrospinal fluid A beta 42 levels in late life. Serum potassium is a modifiable risk factor, and further examination of the potassium and dementia relationship is warranted. Well, we now know. Okay, got this one. Oh, let's make this quick. Diabetes. I told you earlier, one of the major things that is an indicator of potassium deficiency is if you get very, very tired soon after you eat. So if you eat and within 10 minutes of eating, you're just wanting to fall asleep or you get really tired, potassium deficiency is what you should work on. And then you work on all the other toxicities. But the thing you can fix the quickest, get more potassium with that meal, and I bet you won't crash after it. Potassium measurements and risk of type 2 diabetes. Low serum potassium increases the risk of type 2 diabetes in a linear dose response manner. More potassium, less diabetes. Linear. Low serum potassium levels and risk of type 2 diabetes. Mild to moderate, listen to this, listen to this. Mild to moderately low serum potassium levels within the normal range and without frank hypokalemia. So they're saying you're not low in potassium on the blood test because the ranges are too big. That's not what they're saying. That's what I'm saying. So if you're just in like so if you think of, if you take the potassium range and then you divide it in half, as that's the midpoint, and then you're looking at the lower half, you're still in the normal range, but you're in the lower half. That's what they're saying here. Mild to moderately low serum potassium levels within the normal range and without being low potassium, like out of the range, could be predictive of type 2 diabetes in apparently healthy Japanese men. You have to understand the implications of that statement. They're saying these are apparently healthy Japanese men, and their potassium is in the normal range. It's just on the lower half, and it could be indicative of type 2 diabetes. Wow. Potassium and risk of type 2 diabetes. Potassium deficiency is a well-established correlate of disturbances in glucose metabolism. Crashing after you eat. Your blood sugar control sucks because you don't have enough potassium. Now, magnesium is extremely important in blood sugar control. If you have blood sugar problems, blood sugar regulation problems, two of the biggest things you can work on immediately, topical magnesium and get your potassium better. Now, what about toxicity? Indeed, it is worth noting that the rise in the incidence of diabetes is concomitant. It goes along with the rise in the use of thiazide diuretics, which deplete potassium. They're just noting this. These diuretics are used more. They deplete potassium. Diabetes seems to be going up. So can multiple things cause this? Of course. Okay. Low potassium is a possible risk factor for diabetes. Okay. We got that one. Oops, wait. Let's do this one. Nope, don't want that one. Okay. Are we almost done? Liver disease. Hey, imagine us talking about liver disease here. Okay. Low serum potassium level is associated with non-alcoholic fatty liver disease and its related metabolic disorders. We talk about here how the liver is in control of everything. How your liver's doing determines how you're doing. It is in charge of everything. So if you think you have an adrenal problem, you have a liver problem. You got a hormone problem, you got a liver problem. You got a digestive problem, you got a liver problem. And if you don't understand this yet, you need to go watch episodes 53 and 71 so you can understand toxic bile paradigm, which used to be called toxic bile theory. Your liver can still be running, but if it's not running well enough to detox you and you're lacking nutrients, other things break down. That's where people get confused, and doctors are terrible at diagnosing liver problems. They're terrible at it. So what we assume here and how we fix people of all these seemingly unrelated problems with the same general concepts and principles is because we're fixing the liver, and the liver is running everything. So if we make the liver better and your bile less toxic, everything runs better. So fatty liver disease. What is fatty liver disease? You're storing fat-storable, fat-soluble toxins in your liver. You've got so many fat-soluble toxins going on, your liver can't handle it, so your liver starts making more fat to store it in. That's how this happens. It's not carbs. Okay? Alcohol's a toxin. Oh gosh, alcohol goes along with fatty liver, but you can have non-alcoholic fatty liver disease. Gosh, what fat-storable toxins were we just talking about today? Oh, rat poison vitamin D3 and vitamin A alcohol called retinol. And do those both affect potassium? Oh, yes, they do. Low serum potassium levels significantly associated with the prevalence of NAFLD, non-alcoholic fatty liver disease, in middle-aged and elderly Chinese. Middle-aged and elderly. Why? Because they've been alive longer to accumulate more toxicity and more damage. Low serum potassium levels associated with disease severity in children with non-alcoholic fatty liver disease. We are poisoning the children so much with all this trash in our diets and our environment that kids are getting non-alcoholic fatty liver disease. And low potassium levels go along with it. Our study shows an inverse relationship between serum potassium levels and the presence of aggressive disease. Non-alcoholic steato, that's fatty, hepatitis, that's inflamed liver. So that's different than just fatty liver disease. There's fatty liver disease without inflammation. That's like the NAFLD. And then there's NASH, which is non-alcoholic steatohepatitis. That's inflammation in the liver and it's fatty. And fibrosis. They're being nice here. This is cirrhosis. These are children getting cirrhosis. Their livers are basically turning into the liver equivalent of raisins. That's how busted up they are. Okay. Body and serum potassium in liver disease. They're going to look at body potassium. This is legit. Like trying to do this is like real medicine. Trying to look at how much potassium is in the body. Trying to look at where the potassium is in the body. Not just, do you have enough potassium in your blood? Is that important? Yeah. But if you can't, so you remember how I said, like, if you have potassium in your body that you can let go of during stressful situations, you do better than the people who don't. This is why low blood potassium is, if your body had the potassium, would it raise the blood potassium? If it was under stress, yes, it should. If you don't have enough potassium, though, you can't even do that. So I'm going to try to explain this as I go. So liver disease is one of the top 10 killers of Westerners, and doctors are terrible at diagnosing it. So you can imagine that tons more people die from it than doctors would ever let on because they're terrible at finding it. Serial determinations of exchangeable. This means potassium that can move from compartment to compartment. Did we talk about that? Trouble moving from compartment to compartment. And ratios derived from it in the same patient or comparisons of total exchangeable potassium to total body water with anticipated normal values for the study. The group studied appeared the most valid methods of associating body potassium stores in patients with viral hepatitis or cirrhosis. Well, it's not a virus, it's just toxicity. And cirrhosis is just really bad liver situation. Reductions, less exchangeable potassium, approximating 500 millieqs, were found in a high proportion of patients with hepatitis or cirrhosis. More vitamin A toxicity was found in patients with hepatitis or cirrhosis, is what I'm going to simplify that to. They couldn't exchange it. Low values are present particularly in patients with severely impaired liver function. And listen to this. Repletion with potassium supplements can rarely be achieved in this group. What might be getting in the way? Oh, I don't know, toxicity. What accumulates in the liver and causes liver disease? Copper does. What accumulates in the liver and causes liver disease? Vitamin A does. What accumulates in the liver and causes liver disease? Manganese. Vitamin D supplements. Any kind of fat-soluble toxin that you've ever heard of. So they couldn't even fix it. That's how bad these guys are getting. So what's more important? So what am I saying? We fix the potassium problems over time by fixing the toxicity. So how would these folks need to fix their potassium problem first? What is always most important? Stop intoxing before you worry about detoxing. So you start getting rid of the toxins, then maybe these folks, potassium supplements would eventually work better. It doesn't mean that potassium might not help them at all. It just means they got to fix the liver problem. Did you know that we've reversed cirrhosis completely in a person? Labs and imaging, we have completely reversed cirrhosis for a woman. How do we do that? For all the haters out there who say we're doing things wrong, how did we do that? You know what diet this woman did? The cowboy diet. Beef and beans. Every day, every meal. Beef and beans. Would anybody else out there tell you that you could fix liver? What if I just gave people the C word? It rhymes with pure. What if I just told people that was the C word for cirrhosis? Would they do it? Other people on the internet would say, that's not possible. That's not possible. Well, you know what? That's what her hepatologist said, her liver doctor said. He's like, I don't know what you're doing, but it's working. And she told him about what she was doing afterwards. And is he doing it with any of his other patients? Take a wild guess. No. Hepatologists mainly just watch people die. Don't drink alcohol. There's your medical advice. Good job, doc. Okay. Changes in body exchangeable potassium are unrelated to those in serum potassium concentrations during the course of hepatitis or cirrhosis. Wait, have we heard this before? The vitamin A levels in your blood do not correlate to the amount in your liver as well as people want to think. So you could have low vitamin A in your blood and have tons of vitamin A in your liver. And they just said changes in body exchangeable potassium are unrelated to the amount of potassium in your blood. So your whole body potassium is not necessarily related to your blood potassium. They just said it. It's the same thing as vitamin A. Blood tests, why do we only do about 4 blood tests? And we don't waste your time or your money on all the other crap. Because most of it is just symptoms, and it doesn't necessarily correlate to what's going on inside of you. And if we know the approaches to reduce toxicity and restore your nutrient status, and that's what fixes those symptoms on your blood test and the symptoms in your life, we don't have to measure all that crap. Okay. So, yeah, CEW and Damon, Joe's just letting me know I'm going to have to get to those super chats next week. I'm going to go over what to do about how to fix your potassium levels if you choose to experiment with them. Oh, I'm just going to hit on this real quick. If you guys want to look at these links, they're in the link. Yes, there is connections between potassium and chronic kidney disease, which is what Grant Genereux fixed, that his doctors had never seen fixed before. So we're fixing things that doctors have never seen fixed before, like liver cirrhosis and chronic kidney disease. So anyway, if you want to look at these, this is the last link. I don't have time to go over these. Oh, but no, this is an important one. Let me hit on this one. Effect of dietary potassium restriction on serum potassium, disease progression, and mortality in chronic kidney disease. So the doctors will tell you you need to eat less potassium because you have high potassium in your blood, and therefore you need to eat, or you'll hear people say potassium is bad for your kidneys. Low potassium diets are recommended to reduce serum potassium and prevent complications of chronic kidney disease. But evidence underpinning this recommendation has not been systematically reviewed and synthesized. So it's a garbage recommendation. They're doing what doctors do. We see too much potassium, therefore you should eat less. That doesn't mean the potassium is causing the damage. It's a side effect of the root cause problem, which is toxicities and deficiencies, damaging kidneys. Very low quality evidence supports consensus. The consensus, right? Sounds like jabs, right? Very low quality evidence supports the consensus that the way that everybody thinks that dietary potassium restriction reduces serum potassium in normal kalemia and is associated with a reduced risk of death in those with chronic kidney disease. Let me simplify this sentence. Very low quality evidence supports the consensus. So they're saying there's not good evidence to support the thing that everybody thinks, that restricting dietary potassium is associated with a reduced risk of death in those with chronic kidney disease. So they're just lying to you about nutrition again because they make stupid ass assumptions. Okay, so anyway, you can see the rest of these links. There's this one, there's this one, end-stage renal disease. There's this one. And like I said, If you go and you look at these links and you see, oh my gosh, in chronic kidney disease, there can be really high potassium and there can be really low potassium. I explained that to you before. These people are not getting, they're actually usually on sodium restrict or potassium restrict diets. Where is all this potassium coming from? Because that's what doctors usually recommend. It's coming out of busted open cells. Things are breaking down, right? Like if you drive behind a car and all of a sudden you see an oil slick under the car, is there still oil everywhere? Yes, the oil is still there. The oil is not in the car. It's supposed to be in the car. The car has an oil deficiency now, and the road has an excess of oil. You understand? These things, they can measure these things, but like we were talking about compartmentalization, they need to be in the right area to do the right thing. So that is that. Okay, so let me get into generalities around potassium. Okay. Oh, Joe, you don't need to, you can stop the share. We're not going to be sharing anymore. Yeah. So what to do about potassium? First, in the love your liver world of low vitamin A. No, I don't recommend avocados on a regular basis. Two high potassium foods that I do not recommend on a regular basis. Avocados, white potatoes. Are white potatoes low in vitamin A? Yes. Are avocados excessively high in vitamin A? No. But we have research showing that avocados greatly increase the vitamin A absorption from anything else you eat with them, which is generally true of fats. And avocados are like the weird alien fruit that's just full of fat. They do have some fiber. Like, I'm not saying to never eat avocados again, but like having an avocado a day or like just cramming guacamole down your pie hole, no. You're not doing the right thing. And yes, there's potassium in them, but we look at all the factors in the food, not just does it have potassium in it or is it low vitamin A? We don't just do one thing. So there's that. Potatoes, white potatoes are a nightshade. White potatoes, people consuming white potatoes daily is one of the biggest things where people do the program and they feel good at the start because they're lower in vitamin A. And as they go along in the program over months and months and they're eating white potatoes daily, then they start to go, I've been developing these problems. I don't understand why. And it's because potatoes are a nightshade. They are inflammatory by nature. The glycoalkaloids in them, solanine and chaconine, are toxic. If you consume them too often, what happens with those toxins in your system? They build up and then you get problems. So if somebody was going to eat, like if somebody felt fine when they ate potatoes and they were going to eat them once a week or maybe twice, and they weren't going to put in an obscene amount of dairy with them, like butter or sour cream or whatever, they're going to eat them in a like a low vitamin A kind of way, that's not terrible. If you're eating potatoes every day and all of a sudden you start going, I don't think this low vitamin A diet works. I'm getting, my asthma's coming back. That's one thing I heard. I'm like, you're just eating potatoes every day. Potatoes are sneaky in how they will build up in your system. So, and you need to peel them. Peel them deeply and cook the crap out of them. If you're going to eat potatoes, they are high in potassium. Now, the other thing you can do, the other foods that we tend to favor, I mean, bananas, coconut water, if you're going to do it. If you wanted, apples are not super high in potassium. They got some. Grapes, green grapes have some. It's a short list. It is what it is. It's not my fault. So that's the foods. So like I've already had 2 bananas today. If I start missing my bananas, I tend to be very sensitive to my potassium intake. If I start missing my 2 bananas in a day, I feel it within a couple days. I start going, why am I just, my energy's not as good and my brain function's not as good and what's going on? And then I go, oh yeah. Oh, we've been out of bananas for a couple days. Yeah. Okay. So like when I visit Kelsey, she makes sure to have bananas around because that's what I like to have around to start the day. It just makes sure that my day is going to go good. Potassium is that important. So that's the food list. Then there's 50-50 salt. 50-50 salt is something I kind of made, but it's also out there. I learned about it as like salt replacers or whatever. Okay. Here's the simple recipe. And if you mess up the recipe and you say you don't like the taste of it, you're the one who messed up the recipe. Okay. Now, a cup of salt, clean, bright white, single ingredient salt like Jacobson. Okay. A cup of it, fine ground, not flakes, not chunky stuff. Okay. 1 cup, 8 ounces. 1 cup, 8 ounces of potassium chloride powder. Very simple. So now you've got equal parts basically of sodium chloride and potassium chloride. Key ingredient to add: 1/4 teaspoon. 1/4 teaspoon of cream of tartar. It's potassium bitartrate, so you're adding a teeny bit more potassium, and you're adding tartaric acid bound to that potassium. And what this does is this helps adjust the flavor of the potassium chloride a little bit, so it doesn't have. So some people, when they eat potassium chloride in the 50/50 salt, they can taste like a little bitter taste or a little metallic taste. Potassium chloride is a different molecule than salt. That's why potassium chloride is not used on food, is because it has this little taste to it. So a cup of salt, a cup of potassium chloride, 1/4 teaspoon of cream of tartar, and that adjusts the flavor. Now, let's say you make it that recipe and you don't like it. You're like, this still doesn't, it's going to be less salty than normal salt. I just said it. I'm going to say it again. It's going to be less salty than normal salt. Just a bit. So you can use a little bit more because now you only got half the sodium in it and you got half the potassium. So what you're doing in your diet is you are increasing the potassium intake while you're decreasing the sodium intake. Gosh, what did those studies say? Less sodium, more potassium. And you can adjust. You just take normal salt and you replace it with 50/50 salt, and you've already shifted your balance. So if you don't like that recipe, you can make the recipe however you want. Add more salt to it and less potassium chloride. Make it like 75% salt and 25% potassium chloride. You're still getting less sodium and more potassium than you were before. Comprende? Okay. Now, if you're going to ask me about the like low salt or the other mixtures out there, can you do those? There is one, I think Morton's makes a 50/50 mix. They put tartaric acid in it. Imagine that. But they also put in all sorts of other crap, drying agents. You just heard the recipe from mine. It's 3 ingredients, all stuff that is, it's all basic. I don't want silica in it. I don't want any potassium iodide toxic crap. I don't want anything else in my salt. So if you want to go out and say, is this other stuff okay? I'm going to say I wouldn't use it. If people are too lazy to combine 3 powders in a jar, I guess that's your option. Like if you're really too lazy to mix 3 powders in a jar, you might want to think twice about doing the Love Your Liver program, because I'm asking you to do a lot more work than that. We do sell potassium chloride in our store. I'm going to work on, actually, Kelsey really has wanted me to make 50/50 salt for a while. So, because people are just going to buy it. It is easy, but remember, you pay for convenience. So that's how the world works. Okay. Then we go into potassium supplements. Okay. Remember, recommended daily intake from the Institute of Medicine is 4,700 milligrams of potassium a day. If you make the 50/50 salt, a teaspoon of it has a teaspoon of the 50/50 salt has about 1,500 milligrams of potassium in it. A teaspoon, full teaspoon of the 50/50 salt has about 1,500 milligrams of potassium in it and about the same amount of sodium. It's close enough. Okay. So then what some people do is, first, you could just start eating more potassium foods. You could start using the 50/50 salt. A lot of people on the program, the 50/50 salt's their main potassium source. Okay. If you want to add other supplements, the ones that we tend to use, different people can react differently to different forms of potassium. So if you try one form of potassium and you go, I didn't feel good on that, That doesn't mean you don't get along with supplemental potassium. It means you didn't get along with potassium chloride. People take potassium chloride supplements or the powder in water. Kelsey told me this about like people at her supplement store who would come in and buy potassium chloride powder because they read on the internet it's good for their heart and it's good for everything. And they go home and they take like a spoonful of it in water. A teaspoon of straight potassium chloride powder is 2,500 milligrams ish. Or it's more like 3,000 milligrams of potassium. And they came back in, they were like, oh my God, it gave me palpitations, or my stomach got so upset. Don't do that. Don't start that high. Let me explain something about potassium supplements. Why can you only get 99 milligrams in a pill of potassium these days? So 99 milligrams, I want you to understand. This is super common. People will come and say, Doc, I've been taking a potassium pill a day and I don't feel any different. And in my mind, I'm going like, come on, like seriously. A banana's 500 an organic banana is 500 milligrams of potassium. I tell them, you took a bite of a banana. Do you expect your life to change from a bite of a banana? And they go, no. And I go, okay, you're going to have to read the articles a bit more and realize that you could do more. Okay. And then they go, but that's a lot of pills. And I go, that's not I didn't make it that way. I didn't do that. What happened? So I want you to remember some of the earliest paleo tardation that went on. This was like back when I was a teenager, was these guys who were like the early paleo guys said, well, cavemen got like 10,000 milligrams of potassium a day from their diet, and they didn't salt their food, and they were amazing physical specimens, so we're going to do that. 10,000 milligrams of potassium a day. So they started not salting their food and taking supplements. They used to sell 500 milligram and 1,000 milligram pills of potassium. 1,000 milligram pills of potassium. Conventional medicine still sells 1,500 milligram pills of potassium. It's called K-Dur, and you can get it at 1,500 milligrams a pill of potassium chloride. However, it's full of all the pharmaceutical crap, the titanium dioxide, the binders, and it's slow release. K-Dur is slow release. So not only are you getting the toxic slow release stuff, but it's not going to tend to cause the stomach upset, and it's not going to cause the massive rise in potassium in your blood. So it's got those advantages, but it's also pharmaceutical crap. Okay. So these guys were taking mega doses of pills, and then they went to the hospital with arrhythmias and all the other hyperkalemia, the high blood potassium problems, because they were stupid. Didn't I go over the mega dosing thing earlier today? They were stupid and they mega dosed, and they got the FAFO. They FAFO'd. You want to mega dose stuff? You're not doing my program. That's it. So they messed themselves up. There was also an old potassium cleanse. Gosh, the cleanses. Guys would take, so you know how you take enough magnesium, folks, and you're gonna poop. You're gonna get loose bowels if you take enough. If you take enough of any type of magnesium, you're going to get the runs. If you say, well, I take a lot of magnesium and I don't get the runs. If you don't take enough of it to get the runs, you don't get the runs. If you take enough of it to get the runs, you get the runs. So potassium, if you take, have any of you ever taken a ton of salt and gotten loose bowels from taking a ton of salt? I have. You can do the same thing with potassium. Okay. So these guys back then, this was another stupid thing they did with potassium. And another reason why you can only get 99 milligram potassium pills is because they would do a cleanse with potassium. They wouldn't eat very much. They didn't eat at all, or they wouldn't eat very much. They'd take obscene amounts of potassium until they got diarrhea. So imagine you taking obscene amounts of potassium, so much that it gives you diarrhea, and then you're going to the hospital with heart problems. So these stupid people in the past, mega dosing, imagine that, are the reason why you can only get 99 milligram pills in potassium. It's not my fault. So 99 milligrams is a bite of a banana. So if you want to do pills, if you just won't do powders, You're stuck with 99 milligram pills. It is what it is. So, and I tell people, like, if you're going to go up in potassium, I suggest if you're supplementing, you only go up by about 100 milligrams a day. Simple and methodical and smart. So you have time to realize, oh, I don't feel good on that dose. Maybe I shouldn't go up tomorrow. Maybe I don't feel that great on this dose. Maybe I should go back down one. Okay. So pills are good for figuring out your dose. Joe, FAFO means F around and find out. I was saving it for the algorithm to not ding me. So the types of potassium that we tend to use. One I don't use as a supplement. Okay, so some of you are going to ask a bunch of questions because you're not going to listen to me here. Potassium bicarbonate is great for buffering flush niacin. You want to know about buffering flush niacin? Don't ask here. Join the Love Your Liver program. Okay. Potassium bicarbonate is great for buffering flush niacin because then you get potassium nicotinate and the alkaline part of it, poof, disappears and you have neutral potassium nicotinate. I buffer my flush niacin with potassium bicarbonate all the time. Do not take potassium bicarbonate you can easily, okay, any of you who are out there wanting to take supplements in high doses that are alkaline and you're doing it for a long period, this includes baking soda, sodium bicarbonate, potassium bicarbonate, magnesium carbonate, calcium carbonate. Calcium carbonate is Tums. Shuts down your stomach acid. That's what it does. These things are very alkaline, so do not supplement alkaline supplements to try to get the mineral. Understand? If you want to get sodium, salt your food. Don't take baking soda. If you want to get potassium, you can use one of the other potassium supplements, but don't just take spoonfuls of potassium bicarbonate. You can cause a metabolic alkalosis over time, and no, being overly alkaline is as much a problem as being overly acidic. This is why we don't supplement daily with potassium bicarbonate, sodium bicarbonate, magnesium carbonate, or calcium carbonate, because they are overly alkaline. And they will, over time, taken enough, they will alkalize you. And you will get problems from that. But we can use those as a buffer for the flush niacin, because when, let's say, the magnesium and the magnesium carbonate binds to the nicotinic acid, it becomes a neutral, the carbonate turns into carbon dioxide and water, and then you have magnesium nicotinate, which is neutral in pH, and the carbonate part of it is all gone. So if you don't understand that chemistry of it, I mean, I don't know how to explain it any more simply. Potassium supplements. Potassium chloride is an option, but it does tend to cause upset stomach in some people, not everyone. We have tons of people doing the 50-50 salt. It doesn't cause stomach upset in everybody. If you're one of the people who gets stomach upset from potassium chloride, what's the saying you apply here? Doc, it hurts when I do this. Well, then don't do that. Don't use potassium chloride if it upsets your stomach. Or take it with a good, solid meal. That may get rid of your problem. Don't take potassium chloride on an empty stomach. That's not a good idea. Other ones that we tend to use, potassium gluconate, potassium citrate. I guess there's potassium aspartate out there. I don't use that. If I'm missing one, let me know. If I forgot one, guys, I don't think there's another one. Well, Hound Jog, yeah, don't take bicarbonate as a potassium supplement by itself. Don't. This is really, really important. I have, just so you know, am I saying to not use baking soda or magnesium carbonate or potassium bicarbonate? I'm not saying not to use them. I have all three of them on my supplement desk, powder bags of powder of all three of them. I use them. I do not take them by themselves as a supplement. I mix them with my flush niacin. Okay. Never Surrender says, what about beans for potassium? Beans have a good amount of potassium in them. I mean, yes, you can get, the foods that we tend to eat. I mean, meat is generally, meat by itself. I'm not saying meat is bad. We love meat around here, right? Meat is the highest sodium food. Like generally of all the foods out there, meat has the most sodium as a whole food. It doesn't mean it's like super salty. It just means it has the most sodium of most foods out there. Meat has more sodium. Plant foods have more potassium. Okay. Meat has more zinc. Plant foods have more copper. Okay. This is just a general thing. So beans do have a good amount of potassium and they do count. So everything counts. Even if you eat enough meat, you're going to get potassium from meat. You're going to get, so everything counts. Okay. So if you're eating a pretty good low vitamin A diet with the foods that we recommend, and then you're using the 50-50 salt, you've drastically shifted your sodium and potassium balance in a good way. Then if you want to supplement potassium citrate, if you're going to supplement potassium citrate, needs to be non-GMO, must be non-GMO. The citric acid that is used in many products is GMO, made by a black mold, genetically modified black mold. So you want to use non-GMO potassium citrate. The brand I like is Micro Ingredients. They sell it. You can find it on Amazon. You can find it at their stuff. So what else do we got? Potassium gluconate's kind of basic. I mean, I mean like, I don't mean basic as an alkaline. I mean just kind of basic. All these potassiums though, this is very important. They have different amounts of potassium in a teaspoon. Okay. Like potassium chloride, because like potassium gluconate, the gluconate molecule is big. The gluconate part of it is big. Potassium chloride is potassium bound to a chloride ion. That's it. Pay attention here. 1/8, I want you to think about this. 1/8 of a teaspoon. 1/8 of a teaspoon of potassium chloride has 365 milligrams of potassium. Almost a banana in 1/8 of a teaspoon. As opposed to, let's say cream of tartar. I do not recommend using cream of tartar potassium bitartrate as a potassium supplement. A teaspoon of cream of tartar, a full teaspoon, has 500 milligrams. Bitartrate, 2 tartaric acids attached to it. Potassium bitartrate, 2 tartaric acids. So not only there's like potassium gluconate is gluconic acid, right? So it's potassium bound to a gluconic acid. Potassium bitartrate has 2 tartaric acids. So that means cream of tartar is like, in terms of concentration, is the worst source of potassium you could probably use. You got to use more of it to get there. And then by the time you get enough potassium from the potassium bitartrate, the cream of tartar, you're getting tons of tartaric acid. Is that a good thing? I don't know. We ditched it because people were starting to get some issues on using cream of tartar. Now, we don't do things like an adrenal cocktail that certain people on a protocol do, where they're doing high vitamin A, orange juice, and cream of tartar to try to get their potassium. But they still feel better on it because their potassium intake sucks and they're taking too much copper and they're taking too much vitamin A. So they add a little bit of potassium and they feel better. Imagine that. Crazy. This is how much potassium can impact things. Okay. Potassium bicolinate. I've never heard of it, Aaron. I've never heard of that. We are going to, in the next round of supplements, we are going to work on Kelsey's Niasoda, which is a combination of flush niacin and all 3 of the main buffers that I like. There's going to be some sodium bicarbonate, baking soda. There's going to be some potassium bicarbonate, and it's going to be magnesium carbonate. So it's going to be a balanced mix of those. So you'll get, when you mix it in water, you're going to get sodium nicotinate, potassium nicotinate, and magnesium nicotinate all together. So you get your niacin bound to the minerals, works even better, tends to flush less. Buffering does reduce the flushing response. So if you flush a lot and you're not buffering your niacin and you want to flush less, buffering your niacin, read the instructions in the Love Your Liver program. Don't way over buffer for too long. I can't do detailed stuff on all of this. Sometimes people just got figure it out, or you can ask questions in the Love Your Liver program. So I'm trying to think, were there any potassiums I missed? Yeah, for people who are on the cowboy diet and they're doing beef and beans or bison and beans or whatever, red meat and beans, and you're doing a lot of beans in a day, you're getting a lot of potassium, but you should still count. You should still look and see how much you're getting. And then if you do the 50-50 salt as your seasoning, then you're doing even better. So yeah, I think that's all. I got to get going. Okay. So if I missed anything, I'm sorry, but the basic thing with potassium is foods first. Foods first. They're the best. You're going to have the least likelihood of a negative response with foods, even if you're doing potatoes. When I talk to people in my consults, if they say I do amazing on potatoes, what do you think I think? Do you think I think that they have a nightshade deficiency and they're fixing it? Or do you think I go, oh, wow, potatoes are super high in potassium and you feel better from it? You probably have a potassium deficiency. Oh, let me hit this real quick. Okay. Excess potassium symptoms. Right? That's an important thing. Excess potassium symptoms. If you take too much potassium, some of the earliest signs to show up, like if you get heart palpitations or heart arrhythmias on potassium and you just drastically increased your dose, or let's say you try a supplement and that happens right away, even on a low dose, don't do it, the supplement then. Okay? Take your potassium increase very seriously. Don't just, okay, I'm going to tell you this so you know how not to mess up. Some days I take my 2 bananas, and then I have whatever else potassium I have in the day, and then I have about 2,000 milligrams of potassium citrate in my flush drink. Do you think I started out at 2,000? No. Some of you out there might be going, oh my God, that would totally mess me up. Okay, then don't do it. Potassium supplements be careful with them. Did I make myself clear? Go up slowly on potassium supplements. They're not the same as food. You're not going to respond to them the same as food. If you're sensitive to things, realize you're probably going to be sensitive to potassium. Or some sensitive people need tons of potassium, and they do much better on it. You will not know until you try, but don't mess yourself up jumping in too deep. Okay? So, earliest symptoms. One thing, when you take too much potassium, you can get kind of a dry mouth or a hot mouth after you have it. I first learned about this symptom when I had to figure out all these things in the program myself. I used to make a big batch of white potatoes, mashed potatoes for lunch. So obviously potatoes have a lot of potassium in them. And then I would put 50-50 salt on it and I would eat it. And then I couldn't figure out why all afternoon I had this dry mouth, this kind of hot mouth, dry mouth, and I would drink a bunch of water and it wouldn't fix it. I finally, one day I was trying to figure it out. So I look up hypokalemia, too much blood potassium symptoms. And I found hot or dry mouth. I was like, oh, well, that makes sense. It happens every day after my potatoes at lunch. So all I did to fix it was I switched. When I made those potatoes, I would do regular salt. I took away the 50-50 salt. Problem gone. Okay. So one of the biggest symptoms, the two symptoms that you might notice, one would be the hot or dry mouth, and the other one would be anything going on with your heart that you feel you're just like, wow, that's weird. If you feel your heartbeat, that's palpitations. Palpitations are technically defined as you can feel your heart beating. It may be slow, it could be fast, it could be irregular, but that's really what palpitations mean, is you can feel it. And if it's irregular or super fast and you're just like, this is weird, and you've been increasing your potassium, that's probably it. Back off, especially if it's supplements. Some people are even sensitive. I have the gentleman I talked to with the copper issue, the low copper. He doesn't have a copper issue. With the low copper, he is insanely sensitive to his potassium intake. He's doing 2,300 milligrams a day. And if he goes above that, he gets symptoms. If he goes below that, he gets symptoms. And I'm kind of I have not come across this ever. If he does any supplement that is bound to potassium, he says even potassium iodide, when he used to do it, he doesn't do it anymore, thank God. He said the amount of potassium in potassium iodide, which is like micrograms, would cause him his symptoms. Okay, don't do it then. And he just figured out exactly what works for him because he's been working with me for so long. And I tell him what I think he should do to fix the problem. And he listens and he does it and he figures out what works. This is what we do here. We teach people how to figure out what works for you within the framework. So, yeah, just foods are the easiest to figure out if you need more potassium with. And then if you want to mess with supplements because you don't want to eat that many bananas in a day or whatever, then that's what the supplements can come in handy for. So I think that's the main stuff I needed to go over. So again, I'm Dr. Garrett Smith, the nutrition detective around these here YouTube parts. I think Joe already put up on links. nutritiondetective.com is our main website where we have our supplements and you can work with our practitioners, me included, the testing and consultation packages. That's also where you can find the link to the Love Your Liver program, which is at members.nutritiondetective.com if you just want to go straight there. We have now made it a lifetime membership for $199 instead of the $99 a year. So those of you who are renewing this month, you should get an email. And if it says it's renewing your membership, look at the email and see that it says it's free because I have made everybody in the February renewal. I've already done all of you to get renewed at no cost. Okay, so you only got to get through this one email and just go. It should say free, and then you just click OK. So if you discontinue your membership because you think you're getting charged, you're not. You got to read the email. The biggest thing we have issues with in this business is people are not reading their emails when we send them. You don't have to read the news. The newsletters are marketing, right? But we put office closures. We're not going to be shipping out. There's a couple days in the newsletter. We're not going to be shipping out this week because we're moving facilities. If you don't read the newsletters, you don't get to know that. So if you don't read what we send you, you're going to be behind. You're not going to know. Okay. And if you don't read if you're in the Love Your Liver program, but you don't read it, you're not doing the program. You don't know what's in the program. Read it, watch the videos, do the things. Okay. So we will get to those CEW and thank you for the green peeled. Okay. Zen Dog Breath. This is one super chat I'll go over because it's relevant today. Green peeled kiwi. First, kiwi fruit. The skin is the highest oxalate containing food known to mankind. Don't eat kiwi skin unless you want kidney stones. If you even if if you want to eat kiwi, peel all that fuzz off of it. Kiwi's fairly high in potassium. It's also, I've tried to look up kiwi in terms of carotenoids, the plant vitamin A. I can't find hardly anything in it at all. So kiwi technically by itself is very low in vitamin A. And for those of you who are sensitive to oxalates and you don't get along with kiwi, then don't. But most of the oxalates are in the skin. So peel it very well. And it's light green. Oh, no golden kiwi. No yellow kiwi. Only green. If you're going to do that. I don't like kiwi that much, so I don't worry about it. But if you want to do it, well peeled, green, organic as usual. So I think that's all. Oh, and if you want to find me on, well, you guys are obviously watching this here on YouTube, so find me on Nutrition Detective on YouTube, Twitter. I just posted the epic methylene blue is toxic thread on Twitter. I don't have that link right now, but yeah, it's getting a lot of traction. Don't take porta potty dye. I think Kelsey and I are going to redo the methylene blue is toxic video fairly soon because I found a ton new stuff on methylene blue and how toxic it is. And you know, it's an antipsychotic. It's basically, it's directly chemically related to other antipsychotics. Phenothiazines. Yeah. And MAOIs, which methylene blue is one of antidepressants that has withdrawal symptoms. So now you start to understand why so many people don't want to quit it. And they get mad at me for saying it's bad because they don't want to quit it because drugs are addictive and drugs have withdrawals and they don't want to admit it. So anyway, That epic methylene blue is toxic thread. If you want to find it on my Twitter, on my timeline, do a search. So you do from, this is no spaces here, from :NutriDetect in the search box, then a space, then epic methylene or epic methylene blue. Put spaces in there after the NutriDetect like you normally would. But the from NutriDetect, there's no spaces in that. From NutriDetect space epic space methylene or epic space methylene space blue. Okay, so that's what I got. I ran over as usual. I got to rush now. I will see you all later. Oh, on Twitter, I'm NutriDetect. Yeah, NutriDetect. So I'm out of here. Bye now. Oh, Inner Circle people, I already did it on Saturday. It should already be posted. I'll see you all next week. Bye now.